It's been a really exciting 3 weeks leading up to ASH 2015. Each week for the last week a new drug has been approved for myeloma patients, which is really exciting. So we have Daratumumab that's approved, which is called Darzalex. We have Ixazomib approved, which is called Ninlaro, and we have Elotuzumab approved, which is called Implicity. So these are all major steps forward for patients with multiple myeloma. And our challenge now in the clinic is how do we use these drugs to improve outcomes for myeloma patients and to improve cure rates for newly diagnosed patients. And so they each have different characteristics that are really important. So Ixazomib is the first orally available proteasome inhibitor. And so for maintenance regimens and long-term treatment, this is really important for patients. So rather than coming back and forth to the clinic every week for an injection, they'll simply have tablets which they can take at home. And that's really going to change the environment, I think, for people. Daratumumab is the first antibody treatment that targets the myeloma cell, and I think it's going to revolutionize outcomes for myeloma because it's going to be combined with all our standard treatments. It is pretty non-toxic, and we're going to see just a lift up across the board for everybody. The third of the drugs, Elotuzumab, Implicity, is the first of a generation of immunomodulatory drugs which enhance NK cell activity and fix the patient's own immune system towards killing the myeloma cells. And so it's a very simple treatment. It doesn't have toxicity and it improves the outcome of the IMiD drugs. So very exciting times with lots of new agents, getting them approved, getting them to patients, and finding out how to use them best is the challenge for the next year. I was trying to kind of describe that. So I think Daratumumab is going to find its way to the front line for newly diagnosed patients and will be part of induction consolidation and may fit into the maintenance scheduling as well. So it's going to be widely used. Ixazomib is an oral agent with a good safety profile, so people are going to be able to stay on it a long time at home without having to pitch up at a doctor's surgery. So it's going to be a drug that's going to fit into long-term maintenance strategies. Similarly for Elotuzumab, Elotuzumab makes Revlimid a better drug, and so the combination of those two is going to be widely used, but again it has very good characteristics for long-term treatment, making the immune system keep the tumour cells under control.